Leslie Lefevre, and I am the clinical manager of the youth therapy team here at Zepf Center. As part of that role, I hold a small caseload that works primarily with the early childhood population, so ages 2 to 10. And I also supervise therapists on the team as well as interns, and then help the therapists work towards independent licensure.
I guess maybe starting with what you see with trauma with youth and how it's impacting a lot of the youth, and then some tips that you give with your youth, and even as you're helping your other clinicians to try to help youth process through that trauma.
Mm-hmm. So one of the primary things that I've noticed with some of the families that come in seeking services is what's missing a lot of times is the psychoeducation piece of what constitutes a traumatic event. So a lot of times families come in and trauma has been so normalized for them that they don't even realize that they've experienced a traumatic event or that the symptoms they're experiencing are from the trauma. So from what we've noticed, because we use trauma screenings as part of our intake process, and a lot of times families will tell us throughout gathering the history of what brings them in, and we even ask like any history of like abuse, neglect, traumatic events, and a lot of times these families will tell us no, but then they fill out this trust event survey and they will report multiple events on that. And so just having that knowledge to be like, okay, obviously this family has been exposed to a lot and it's so much and has been for so long that it's been normalized for them. And so we have these kids that are growing up in like violent neighborhoods or violent schools or watching violent video games. And it's just becoming so normalized that they don't realize that the symptoms they're experiencing are because of the trauma. So what I've noticed is the psychoeducation piece is so important to help these families realize that it was a traumatic event and that these symptoms are due to what they were exposed to, and then kind of helping them figure out what kind of protective factors they can have in place to kind of protect them from those symptoms and help overcome those trauma symptoms. Because what I've noticed as well is kids come in earlier and earlier with what might look like ADHD symptoms, like they're not focusing in the classroom setting, or they're having disruptive behavior in the classroom, and then the parents bring them in and describe the symptoms. It might sound like ADHD to us, but then once we ask about the trauma history and they're like, well, yeah, they were exposed to like a shooting in the neighborhood or domestic violence, and then their behavior starts to make sense. Whether it's like running out of the classroom when the teacher is raising their voice, or they're super distracted and hypervigilant in the classroom. So to the teacher's mind, they might look like they're not paying attention when in fact it's just they're being triggered by the environment, or they have so much going on and they want to protect themselves that it looks like they're not paying attention. So I find the psychoeducation piece is so important to be able to make that determination between like what is like trauma and PTSD, and then what are these other factors that might be happening, whether they do have like a co-occurring disorder.
As you're working with families and as they realize that it is in fact some of these triggers or some of the responses to trauma, what are some tips or ways that you help them to be able to process through that and to be able to, I guess, heal from some of those traumas?
Mm-hmm. So the majority of the therapists on my team are trained in trauma-focused cognitive behavioral therapy. So that is that's the evidence-based practice that we typically use with kids who do come with a PTSD diagnosis or trauma symptoms. And so when we decide that we're going to use TFCBT, it's a very set protocol where we do start off with the psychoeducation piece of talking to the family about like, this is the event, and talking about how like it is not a normal everyday occurrence for everyone. And we kind of talk about like the statistics of the traumatic event, as well as like other information regarding the event that happened. So a lot of it is about psychoeducation about the event specifically that they encountered, as well as psychoeducation about trauma symptoms to look out for. And then once you get through the psychoeducation, where like the parent is highly involved as well as the youth client, then we move on to talk to them about like coping strategies, relaxation skills that they can use. There is a portion that we do talk about like thought stopping and how to prevent like traumatic thoughts from blocking them from being able to like experience other events or concentrate in school. So we do talk about like the cognitive triangle and how to stop the thoughts that are leading to those negative feelings and negative behaviors. And then once we get through all of the psychoeducation pieces and the client is able to build up all of their coping strategies, and once they're feeling ready to tell their story, then we do have a trauma narrative portion of the treatment where they get to tell their story in their own way, whether it's writing a book, or I've had kids that really like using PowerPoint to do like a slideshow about what happened and a slideshow about their event, the event they experienced, their life. And then we always include a piece of it where it's like future focused. So really getting them to realize like we can overcome this. And I do have a future and I do have things that I can accomplish. Just because this bad thing happened doesn't mean I can't move past that. And then the final part of it would be sharing their narrative with someone else if they choose to. So we would typically have them select a safe person. Typically it ends up being like the caregiver. And then we invite the caregiver into the session to hear the story and process that with the client and be able to be there for a support.
Is that a common practice within clinicians as far as this evidence-based curriculum you were talking about? Or is it something that not everybody is trained in?
I would say it is becoming more common to get trauma training and be trauma informed, but it is not as common as you would probably think, because we do tend to get a lot of referrals from like school-based services or other practices to come here specifically for trauma treatment. And so it is sometimes common where, say, they have a provider in the school setting that is addressing classroom behaviors, and then they refer to us specifically to just do the trauma treatment. And so we have done that before, where it's kind of like working together to address school stuff, because obviously they need to maintain in the classroom. And sometimes when you're doing trauma work, it can kind of stir things up. And so then we work specifically on those trauma goals. So I feel like it's becoming more known and more common to get the experience and get the training, but trauma training is so expensive to get good training. So like TFCBT and then EMDR is another one that's becoming more popular. We don't have any staff currently trained in that, but it is becoming more popular as well. And just the trainings alone are so expensive to get fully certified as a trauma therapist. And so I feel like that's a big barrier, especially when you do work in community mental health, where agencies tend to not have as many resources to provide those kind of trainings. Luckily, since trauma is becoming, like people are becoming more aware of it and the effects that it has on children, there are more resources out there, like websites that can provide psychoeducation and at least some basic training and basic knowledge of those skills. So at least that's becoming more common to overcome that barrier. But I would say the school-based clinicians are typically not as trauma informed or trauma trained.
In your opinion, would you think, because I've heard presentations on ACEs,
Yeah.
would you think hearing the presentation on ACEs would at least kind of get that conversation started and make people a little bit more aware, and even utilizing, I don't know your opinion on utilizing the ACEs questions just to help highlight with youth you might be working with that maybe they, like you said, have experienced trauma that they didn't really identify as being trauma at the time?
Yeah, I would definitely agree that that is very important because I know we don't specifically use the ACEs as part of our intake, but it's very similar. It's called the Childhood Trust Event Survey. And like I said, a lot of the families don't even realize that it was traumatic until they look at that and they're like, oh, yeah, I guess that wasn't the best thing that they experienced. And so I do feel like that would be a really important tool for the schools to have that knowledge of, because I know I have worked with kids with a trauma history before, and I've gone into the schools for IEP meetings and talked to them about like, what are the behaviors you're seeing? And I had remember one client in particular, he kept hiding under his desk, and the teacher was so frustrated and was like, he just keeps doing this. He won't do the work. He's just defiant. And so after talking to the kiddo more and talking to the school staff, we realized his teacher was a loudspeaker and he had been exposed to domestic violence. So it was kind of triggering some of those things for him. And so the school, just knowing that, it was kind of that aha moment, like, oh, he's not being defiant, he's being triggered. And so I feel like a lot of the school staff doesn't really have that knowledge or background to know what to look for and to maybe take the time to think through, like maybe there's something else and they're not just being a defiant child, because typically it's not purely defiance.
I completely agree. So I started off in education. I taught fourth grade math and science for 4 years and then seventh grade math for 3 before going into mental health and prevention services. And I remember feeling very similar in, kind of having that understanding that these youth are acting out for a reason. But sometimes when you're caught up with trying to manage 20 some children and teach a curriculum and the standard testing and all of that you have on your plate, you just kind of go in that automatic stress mode of like, you just need to sit down and behave. You're
Right.
causing me problems right now. And, instead of kind of stepping back and thinking like, what is going on here? These are warning signs for something. So maybe this video resource will be a tool that will encourage other people to get that training and understanding so that they can try to manage the youth a little bit better and help understand them so that they can feel safe and protected and be able to learn. Are there some other tools that work really well as far as helping the youth kind of move through the trauma?
I would say the biggest piece is really listening to them and what they need. So, first of all, that's knowing their trigger points. And so, we always start with like writing down a list of what are the things that trigger them so that we're aware of those things. And then helping them realize, like, how does your body feel? Like, what are your warning signs that you are going to start getting triggered? Or what are the warning signs that you are about to go elope and run out of the classroom or want to hide under the desk? And then once we're aware of those things, then we can start introducing different coping strategies and being more proactive about using those coping strategies. And so, especially in like a classroom setting, we always talk to them about like what is a safe space. And I feel like that's one area where schools have been really great lately as far as having like calm down areas in their classrooms. I feel like a lot of classrooms I hear of now have a designated area for kids to go to that is safe. They can just like walk away from their desk and de-escalate before returning to the lesson. And I feel like that is really important, that they have an area that they feel safe, as well as a safe person. So if I can identify any person in the classroom or if they're at home who is your safe person to go to and let them know that I'm being triggered, I need some space, I need to calm down. And so once we can identify like what things make them feel safe, what person can make them feel safe, then we can kind of implement that plan similar to how we would like a safety plan if someone were having suicidal ideation. So it's similar to that, where you would like identify the triggers, identify the warning signs, and then who are my safe people and my safe things that I can do to calm myself down.
I love that. Very informative. Thank you. Another question I guess I'm curious about is, as you've been working with families, because what I hear in the schools or people that work in the schools a lot is, what is going on with kids these days? Like, why are they there's so many, what seems to be mental health issues arising.
Mhm.
Do you have anything that you've noticed with the families you work with that, is there something that could be causing some of this connection as far as, or this disconnect with youth having some of these issues compared to youth in the past?
When I hear people talking about that, I would like to hope that it's more, not necessarily that there's more kids with mental health concerns, but there's just more education and more awareness. Because I feel like in the past, a lot of it was kind of brushed under the rug as like that's just their age, they're going to grow out of it, it's just a phase. And I feel like there is so much more education now regarding mental health concerns and what constitutes a true diagnosis. And so I do feel like that is part of it, is just there's more education out there. But what I've also noticed, and just with my own kids, even coming back from the pandemic has been rough on a lot of kids. So a lot of kids were, at home, hunkered down with their family, and now they're out in a community that might not be the safest, or they're at a school where they might not feel that safe, and they didn't have those like basic skills built up, like if they had kindergarten and first grade at home remote and now they're thrown into a classroom of third graders. That's hard for kids to rapidly learn what their expectations are, what the behavior, what our rules are, what are the expectations of the teacher. And so I feel like that is part of it. What we're seeing as well is just, I feel like the pandemic definitely impacted kids socially and emotionally. And we're kind of seeing that recovery period.
Yeah, the things I've heard, and I'm almost wondering if maybe helping youth understand how to, like you do, like identify their triggers, identify their emotions and how they're feeling, and then be able to verbalize that or express that. They are having more exposure to some of these like violent video games and violent TV shows, and is that part of it? The social media things that maybe weren't around then that are causing this effect. So I was just curious if you've happened to come across things that has kind of been a little red flag of this is kind of lining up with what we're seeing.
And I would say that overall, like the tone of what kids are viewing is definitely becoming more violent, as far as like video games and younger kids talking about playing Grand Theft Auto and Call of Duty. And, I feel like when you watch the news and it's talking about all of this community violence, and then it's already normalized there, and then you have these video games that are normalizing it. I think a lot of times, because the one parent group curriculum that we have talks about the exposure to violence and how that impacts children and like their brain functioning and how they internalize messages. And so we talk a lot about how if you start exposing them at such a young age, it does start normalizing things. And then they, the more violent stuff they view, it doesn't really seem unusual to them. So it tends to kind of get more and more violent as they age, and they're looking to kind of up the ante with what they're watching. And so definitely the video game discussion happens a lot in my office. A Common Sense Media is actually a website I use a lot with my families. That's a really good resource that schools use as well sometimes to kind of help parents see, like, if you look up a video game on their website and they tell you like what age range it is meant for. And a lot of times that alone kind of helps them see that it's not appropriate for their child.
Is there a way to briefly go into some of the coping skills that you do teach youth? Maybe just some of the top ones that could just kind of be highlighted?
Yeah. So the most common ones that I use with my younger ones are deep breathing. And a lot of times, especially the younger one, like the early elementary age, it's really important to have something kind of concrete for them to help them remember the coping skill. So a lot of times I'll use the analogy of like, we're going to pretend we're blowing out candles on a birthday cake. And so we talk about like, what would your birthday cake smell like? And then we practice like breathing in through our nose, like we're smelling it. And then we breathe out through our mouth, like we're blowing out the candles. And so we'll practice that a few times. And then for the muscle relaxation, we will use the analogy of squeezing lemons. So we'll like pick the lemons from the tree and then we squeeze all the juice out and then we shake our hands out and then we practice that a few times. Counting is a really big one, whether the kiddo prefers to count up or count down. And sometimes I'll make like a bracelet with them that they can like count the beads on it to kind of help them stay grounded. Because with trauma, a lot of times our youth, typically not the really younger ones, talk about it. But as they get older, sometimes they might have some dissociating happening when they're getting triggered in the classroom. So we talk about grounding a lot. So finding something tangible that they can identify. So sometimes with those kids, if I have that bracelet, they can pay attention to like the colors of the beads, what the beads feel like, how many beads they have, or like keeping something tangible in their pocket that they can pull out and grab. Or paying attention to, like, if you pay attention to all of your senses in the classroom, like, okay, right now, what am I hearing? What am I seeing? And kind of going through all of those senses to kind of bring you back to your present space.
And as you were talking, I kept thinking, how great would it be if someone like you were able to come into the classroom and teach some of those coping skills to the whole classroom?
Mm-hmm.
To give them, because I feel like every youth and even adult could take that away and be able to use that to help them in their day to day. So that would be a really neat thing. I don't know, just an idea tossing out there, but I don't know if you guys ever do any type of group education like that, or
Typically, we do not in this school setting. I do know a lot of, I'm sure it depends on the district, but for example, like my kids' school district, their school counselor does, I think their quarterly classroom visits where they do lessons as far as like feelings and emotions identification was one of them, coping strategies was one of them. So I know some school counselors do like psychoeducation in the classroom settings, but I'm assuming that probably depends on the district. But we have not done any school-based ones.
so if someone was interested in trying to put their child in a setting so that they could receive the psychoeducation and the counseling, how would they go about doing that? And not just within the Zepf Center, but if they're, watching this from another area, what kind of things do they need to know to ask for when they're trying to reach out and find a counselor who can help them?
I would say the biggest thing is obviously checking like what your insurance covers and which agencies you can go to. And then if they are looking for someone who is specifically trained in trauma, they can ask like if there are any therapists that are certified in trauma treatment. There are specific agencies that specialize in only treating trauma, such as like Toledo has the Cullen Center that's known for treating children with trauma. So there are specific agencies you can look for that treat trauma symptoms. But if they are looking to go to just any community mental health agency, they can ask specifically if there are any trauma therapists on staff.
All right. Thank you so much. I appreciate
Yeah,
your
no
time,
problem.
and you have a great rest of the day.
Thanks.